So when you're talking about mechanical low back pain, and that is pain that is not from an infection, a trauma, or a tumor, when patients come into your office, the odds of them having a disc complaint, especially if they're under the age of 55, is about 40%. So if you talk to your neighbor at, let's say, a barbecue, and they know you're a chiropractor, and they say, I've got this back pain, it's almost a coin flip that it's going to be a disc as long as they're under the age of 55. And you have to then ask appropriate history questions and then do an appropriate exam to justify, to make sure that it is disc and your suspicions are warranted. 31% of patients that walk into your office, and this is before you do any history or exam, they're going to be facet causation, which means the lumbar facets is what's driving the pain. Now, it doesn't mean they couldn't have a degenerative disc. It doesn't mean they could have an old bulge disc. Patients love to tell us that, you know, I've got a bulge disc in my back and I've had it for years, but that may not be what's causing their discomfort right now. And that's why you need to dive into the history and ask the questions and the exam to verify where it's coming from. And then 22% is the SI joint. And usually the SI joint pain is going to be below the belt line. It's going to be on one side, typically it's unilateral, it's not bilateral, but it's the only one of these three that is below the belt line. And so if someone starts to point towards their pocket, or they start to point towards, you know, a little bit below their belt, and they say they have sciatica, you know, they'll point to their SI joint and say, well, my sciatica is acting up. And that's really not true sciatica. True sciatica is all the way down past the calf. So discal is going to be above the waist. Facet is going to be above the waist and usually unilateral on one side. SI joint is going to be below the waist. So just having this information that you can just fix that in your memory, it'll help you figure out where the pain's coming from a little quicker, and it'll make your exams go a little quicker.